The theme of my talk is drug addiction, also known as substance use disorder. Magnitude, causes, consequences, and prevention. Drug addiction and substance misuse are significant public health issues that affect millions worldwide. The magnitude of substance misuse is rising, with factors such as social pressures, mental health disorders, and economic conditions contributing to its prevalence. Consequences can include severe health issues, increased crime rates, social stigma, and substantial economic costs related to healthcare and loss of productivity. Moreover, addiction can lead to family disruptions and broader societal challenges. Drug addiction and substance misuse pose significant global health challenges. According to the World Health Organization, substance use disorder affect millions worldwide, with approximately 35 million people suffering from drug use disorders globally. The disease burden is considerable, contributing to over 750,000 deaths annually due to drug-related causes. The highest prevalence of drug use is seen in low and middle-income countries, with opioids being the most harmful substance. Alcohol and other drugs have long been considered for recreational purposes. So-called illicit drugs are substances for which extramedical use has been prohibited under international control systems. Illicit drugs include, but are not limited to, opioids including heroin, morphine, opium, and other pharmaceutical opioids, cannabis, amphetamines, and cocaine. Harms can also occur due to extramedical use of prescription drugs. Dependence on illicit and prescription drugs can develop among people who use them regularly over a sustained period, and is characterized by a loss of control over use and increased prominence of use of the substance in a person's life. Substance use also carries risks of other adverse health outcomes. For example, injection of drugs carries risk if non-sterile injecting equipment is used because of potential exposure to HIV and viral hepatitis, other infections, and other injection-related injuries and diseases such as sepsis, thrombosis, and endocarditis. Alcohol use increases the risk of unintentional and intentional injury, and both non-communicable, for example, cancer, gastrointestinal, and cardiovascular, and infectious, for example, tuberculosis and pneumonia diseases. Use of both alcohol and drugs can cause harm to others. Alcohol and drug use can have negative consequences on the health, economy, productivity, and social aspects of communities. Alcohol and drug use are important contributors to global disease burden. Effective interventions should also be scaled up to prevent and reduce substance use disease burden. Drug addiction is a disease that affects a person's brain and behavior and leads to an inability to control the use of a legal or illegal drug or medicine. Substances such as alcohol, marijuana, and nicotine also are considered drugs. Addiction is a chronic condition that can affect many aspects of your life, including your physical and mental health, relationships, and career. There are two main forms of addiction: substance use disorders and behavioral addictions. Addiction is treatable. It is crucial to seek help as soon as possible. Addiction is defined as a chronic, relapsing disorder characterized by compulsive drug seeking and use despite adverse consequences. It is considered a brain disorder because it involves functional changes to brain circuits involved in reward, stress, and self-control. Those changes may last a long time after a person has stopped taking drugs. Addiction is a lot like other diseases, such as heart disease. Both disrupt the normal, healthy functioning of an organ in the body. Both have serious harmful effects, and both are, in many cases, preventable and treatable. If left untreated, they can last a lifetime and may lead to death. The initial decision to take drugs is voluntary for most people, but repeated drug use can lead to brain changes that challenge an additional person's self-control and interfere with their ability to resist intense urges to take drugs. These brain changes can be persistent, which is why drug addiction is considered a relapsing disease. People in recovery from drug use disorders are at increased risk for returning to drug use even after years of not taking the drug. In general, people take drugs for a few reasons. To feel good, drugs can produce intense feeling of pleasure. This initial euphoria is followed by other effects, which differ with the type of the drug used. For example, with stimulants such as cocaine, the high is followed by feeling of power, self-confidence, and increased energy. In contrast, the euphoria caused by opioids such as heroin is followed by feeling of relaxation and satisfaction. To feel better, some people who suffer from social anxiety, stress, and depression start using drugs to try to feel less anxious. Stress can play a major role in starting and continuing drug use as well as return to drug use in patients recovering from addiction. Third, to do better. Some people feel pleasure to improve their focus in school or at work or their abilities in sports. This can play a role in trying or continuing use drugs, such as prescription stimulants or cocaine. Fourth, curiosity and social pressure. In this respect, teens are particularly at risk because peer pressure can be very strong. Adolescence is a developmental period during which the presence of risk factors such as peers who use drugs may lead to substance use. If taking drugs makes people feel good or better, what is the problem? When they first use a drug, people may perceive what seem to be positive effects. They also may believe they can control their use, but drugs can quickly take over a person's life. Over time, if drug use continues, other pleasurable activities become less pleasurable and the person has to take the drug just to feel normal. They have a hard time controlling their need to take drugs, even though it causes many problems for themselves and their loved ones. Some people may start to feel the need to take more of a drug or take it more often, even in the early stages of their drug use. These are the signs of an addiction. Even relatively moderate drug use poses dangers. Consider how a social drinker can become intoxicated, get behind the wheel of a car, and quickly turn a pleasurable activity into a tragedy that affects many lives. Occasional drug use, such as misusing an opioid to get high, can have similarly disastrous effects, including impaired driving or overdose. Do people choose to keep using drugs? The initial decision to take drugs is typically voluntary, but with continued use, a person's ability to exert self-control can become seriously impaired. This impairment in self-control is the hallmark of addiction. Brain imaging studies of the people with addiction show physical changes in areas of the brain that are critical to judgment, decision-making, learning and memory, and behavior control. These changes help explain the compulsive nature of addiction. No single factor determines whether a person will become addicted to drugs. Why do some people become addicted to drugs, while others do not? As with other diseases and disorders, the likelihood of developing an addiction differs from person to person, and no single factor determines whether a person will become addicted to drugs. In general, the more risk factors a person has, the greater the chance that taking drugs will lead to drug use and addiction. Protective factors, on the other hand, reduce a person's risk. Risk and protective factors may be either environmental or biological. Risk factors include aggressive behavior in childhood, lack of parental supervision, low peer refusal skills, drug experimentation, availability of drugs at school, community poverty. Protective factors include self-efficacy, belief in self-control, parental monitoring and support, positive relationships, good grades, school anti-drug policies, neighborhood resources. What biological factors increase risk of addiction? Biological factors that can affect a person's risk of addiction include their genes, stage of development, and even gender or ethnicity. Scientists estimate that genes, including the effects environmental factors have on a person's gene expression, called epigenetics, account for between 40 to 60% of a person's risk of addiction. Also, teens and people with mental disorders are at risk are at a greater risk of drug use and addiction than others. Children's earliest interactions within the family are crucial to their healthy development and risk for drug use. What environmental factors increase the risk of addiction? Environmental factors are those related to the family, school, and neighborhood. Factors that can increase a person's risk include the following. Home and family. The home environment, especially during childhood, is a very important factor. Parents or older family members who use drugs or misuse alcohol or who break the law can increase children's risk of future drug problems. Number 2, peer and school. Friends and other peers can have an increasingly strong influence during the teen years. Teens who use drugs can sway even those without risk factors to try drugs for the first time. Struggling in school or having poor social skills can put a child at further risk for using or becoming addicted to drugs. What other factors increase the risk of addiction? Early use. Although taking drugs at any age can lead to addiction, research shows that the earlier people begin to use drugs, the more likely they are to develop serious problems. Number 2, how the drug is taken. Smoking a drug or injecting it into a vein increases its addictive potential. Both smoked and injected drugs enter the brain within seconds, producing a powerful rush of pleasure. The brain continues to develop into adulthood and undergoes dramatic changes during adolescence. One of the brain areas still maturing during adolescence is the prefrontal cortex. It is that part of the brain that allows people to assess situations, make sound decisions, and keep emotions and desires under control. The fact that this critical part of a teen's brain is still a work in progress puts them at increased risk for trying drugs or continuing to take them. Introducing drugs during this period of the development may cause brain changes that have profound and long-lasting consequences. Drug addiction can start with experimental use of recreational drug in a social situation, and for some people, the drug use becomes more frequent. The risk of addiction and how fast you become addicted varies by drug. Some drugs, such as opioid painkillers, have a higher risk and cause addiction more quickly than others. What happens to the brain when a person takes drugs? Most drugs affect the brain's reward circuit, causing euphoria as well as flooding it with the chemical messenger of dopamine. A properly functioning reward system motivates a person to repeat behaviors needed to thrive, such as eating and spending time with loved ones. Surges of dopamine in the reward circuit cause the reinforcement of pleasurable but unhealthy behaviors like taking drugs, leading people to repeat the behavior again and again. As a person continues to use drugs, the brain adapts by reducing the ability of cells in the reward circuit to respond to it. This reduces the high that the person feels compared to the high they felt when first taking the drug, an effect known as tolerance. They might take more of the drug to try and achieve the same high. These brain adaptations often lead to the person becoming less and less able to derive pleasure from other things they once enjoyed, like food, sex, or social activities. Long-term use also causes changes in other brain chemical systems and circuits as well, affecting functions that include learning, judgment, decision making, stress, memory, behavior. Despite being aware of these harmful outcomes, many people who use drugs continue to take them, which is the nature of addiction. Why do some people become addicted to drugs while others don't? No one factor can predict if a person will become addicted to drugs. A combination of factors influences risk for addictions. The more risk factors a person has, the greater the chance that taking drugs can lead to addiction. For example, biology. The genes that people are born with account for about half of a person's risk for addiction. Number 2, environment. A person's environment includes many different influences, from family and friends to economic status and general quality of life. Number 3, development. Genetic and environmental factors interact with critical developmental stages in a person's life to affect addiction risk. Although taking drugs at any age can lead to addiction, the earlier that drug use begins, the more likely it will progress to addiction. This is particularly problematic for teens because areas in their brains that control decision making, judgment, and self-control are still developing. Teens may be especially prone to risky behaviors, including trying drugs. Can drug addiction be cured or prevented? As with most other chronic diseases such as diabetes, asthma, or heart disease, treatment for drug addiction generally isn't a cure. However, addiction is treatable and can be successfully managed. Drug addiction is a treatable chronic medical disease that involves complex interactions between a person's environment, brain circuits, genetics, and life experiences. People with drug addictions continue to use drugs compulsively despite the negative effects. Substance abuse has many potential consequences, including overdose and death. While the term drug abuse and drug addiction are often used interchangeably, they are different. Someone who abuses drugs uses a substance too much, too frequently, or in otherwise unhealthy ways. However, they ultimately have control over their substance use. Someone with drug addiction uses drugs in a way that affects many parts of their life and causes major disruptions. They can't stop using drugs, even if they want to. Signs of drug addiction. The signs of drug abuse and addiction include changes in behavior, personality, and physical appearance. If you are concerned about a loved one's substance use, here are some of the red flags to watch out for. Changes in school or work performance, secretiveness, relationship problems, risk-taking behavior, legal problems, aggression, mood swings, changes in hobbies or friends, sudden weight loss or gain, unexplained odors on the body or clothing. Effects of drug addiction. People can become addicted to any psychoactive, that is mind-altering substance. Common addictive substances include alcohol, tobacco, that's nicotine, stimulants, hallucinogens, and opioids. Many of the effects of drug addictions are similar, no matter what substances someone uses. Effects of drug addiction on the body. Drug addiction can lead to a variety of physical consequences, ranging in seriousness from drowsiness to organ damage and death. Some of the effects include shallow breathing, elevated body temperature, rapid heart rate, increased blood pressure, insomnia, drowsiness, impaired coordination and slurred speech, decreased or increased appetite, tooth decay, skin damage, sexual dysfunction, infertility, seizures, kidney damage, liver damage and cirrhosis, various forms of cancer, stroke, cardiovascular problems, lung problems, overdose, and death. If left untreated, drug addiction can lead to serious life-altering effects on the body. Dependence and withdrawal also affect the body. Physical dependence refers to the reliance on a substance to function day to day. People can become physically dependent on a substance fairly quickly. Withdrawal. When someone with a dependence stops using a drug, they can experience withdrawal symptoms like excessive sweating, tremors, panic, difficulty breathing, fatigue, irritability, and flu-like symptoms. Some of the most common mental effects of drug addiction are cognitive decline, memory loss, mood changes, and paranoia, poor self-impulse control, disruption to areas of the brain controlling basic functions, that's heart rate, breathing, sleep, etc. Depression, anxiety, and psychosis. Effects of drug addiction on an unborn child. Drug addiction during pregnancy can cause serious negative outcomes for both mother and child, including preterm birth, stillbirth, maternal mortality. Drug addiction during pregnancy can lead to neonatal abstinence syndrome. Essentially, the baby goes into withdrawal after birth. Symptoms of neonatal abstinence syndrome differ depending on which drug has been used, but can include excessive crying, tremors, sleeping and feeding issues, seizures. That's epilepsy. Children exposed to drugs before birth may go on to develop issues with behavior, attention, and thinking. Drug addiction symptoms or behaviors include, among others, feeling that you have to use the drug regularly, that is daily or even several times a day, having intense urge for the drug that block out and other thoughts, that block out any other thoughts. Over time, needing more of the drug to get the same effect, taking larger amounts of the drug over a longer period of time than you intended, making certain that you maintain a supply of the drug, spending money on the drug even though you can't afford it, not meeting obligations and work responsibilities, continuing to use the drug even though you know it is causing problems in your life or causing you physical or psychological harm, doing things to get the drug that you normally wouldn't do, such as stealing, driving, or doing other risky activities when you are under the influence of the drug, spending a good deal of time getting the drug, using the drug, or recovering from the effects of the drug, failing in your attempts to stop using the drug, experiencing withdrawal symptoms when you attempt to stop taking the drug. How do you recognize unhealthy drug use in family members? Sometimes it is difficult to distinguish normal teenage moodiness or anxiety from signs of the drug use. Possible signs that your teenager or other family member is using drugs include problems at the school. For example, frequently missing school or work, or sudden disinterest in school activities or work, or a drop in grades or work performance. Physical health issues, lack of energy and motivation, weight loss or gain, or red eyes. Neglected appearance, that's lack of interest in clothing, grooming, or looks. Changes in behavior, that's major efforts to bar family members from entering the teenager's room or being secretive about going out with friends. Money issues, that sudden requests for money without a reasonable explanation. Recognizing signs of drug use or intoxication. Signs and symptoms of drug use or intoxication may vary depending on the type of drug. Marijuana, hashish, and other cannabis-containing substances. People use cannabis by smoking, eating, or inhaling a vaporized form of the drug. Cannabis often precedes or is used along with other substances, such as alcohol or illegal drugs, and is often the first drug tried. Signs and symptoms of recent use can include a sense of euphoria or feeling high, a heightened sense of visual, auditory, and taste perception, increased blood pressure and heart rate, red eyes, dry mouth, decreased coordination, difficulty concentrating or remembering, slowed reaction time, anxiety or paranoid thinking, cannabis odor on clothes or yellow fingertips, major cravings for certain foods at unusual times. Long-term use is often associated with decreased mental sharpness, poor performance at school or at work, ongoing cough and frequent lung infections. K2, spice and bath salts. Two groups of the synthetic drugs, synthetic cannabinoids and substituted or synthetic cathinones, are illegal in most states. The effects of these drugs can be dangerous and unpredictable, as there is no quality control and some ingredients may not be known. Synthetic cannabinoids, also called K2 or spice, are sprayed on dried herbs and then smoked, but can be prepared as an herbal tea. In liquid form can be vaporized in electronic cigarettes. Despite manufacturer claims, these are chemical compounds rather than natural or harmless products. These drugs can produce a high similar to marijuana and have become a popular but dangerous alternative. Signs and symptoms of recent use can include a sense of euphoria or feeling high, elevated mood, an altered sense of visual, auditory, and taste perception, extreme anxiety or agitation, paranoia, hallucinations, increased heart rate and blood pressure, or heart attack, vomiting, confusion, violent behavior. Substituted cathinones, also called bath salts, are mind-altering, that psychoactive substances similar to amphetamines such as ecstasy and cocaine. Packages are often labeled as other products to avoid detection. Despite the name, these are not bath products such as Epsom salts. Substituted cathinones can be eaten, snorted, inhaled, or injected and are highly addictive. These drugs can cause severe intoxication, which results in dangerous health effects or even death. Signs and symptoms of recent use can include feeling high, increased sociability, increased energy and agitation, increased sex drive, increased heart rate and blood pressure, problems thinking clearly, loss of muscle control, paranoia, panic attacks, hallucinations, delirium, psychotic, and violent behavior. Barbiturates, benzodiazepines, and hypnotics are prescription central nervous system depressants. They are often used and misused in search of a sense of relaxation or a desire to switch off or forget stress-related thoughts or feelings. Barbiturates, for example, phenobarbital. Benzodiazepines, for example, sedatives such as diazepam, alprazolam, lorazepam, chlordiazepoxide. Hypnotics. Examples include prescription sleeping medicines such as zolpidem and zalplon. Signs and symptoms of recent use can include drowsiness, slurred speech, lack of coordination, irritability or changes in mood, problems concentrating or thinking clearly, memory problems, involuntary eye movements, lack of inhibitions, slowed breathing and reduced blood pressure, falls or accidents, dizziness. Meth, cocaine, and other stimulants. Stimulants include amphetamines, for example, methamphetamine, cocaine, methyl phenidate, and amphetamine, dextroamphetamine. They are often used and misused in search of a high or to boost energy, to improve performance at work or school, or to lose weight or control appetite. Signs and symptoms of recent use can include feeling of happy excitement and too much confidence, increased alertness, increased energy and restlessness, behavior changes or aggression, rapid or rambling speech, larger than usual pupils, the black circles in the middle of the eye, confusion, delusions and hallucinations, irritability, anxiety and paranoia, changes in heart rate, blood pressure and body temperature, nausea or vomiting with weight loss, poor judgment, nasal congestion, mouth sores, gum disease and tooth decay, insomnia, depression as the drug wears off. Another category is club drugs. Club drugs are commonly used at clubs, concerts and parties. Examples include methylene dioxymethamphetamine, also called MDMA, ecstasy or Molly, and gamma hydroxybutyric acid, known as GHB. Other examples include ketamine, flunitrazepam, or rohypnol, also called roofie. These drugs are not all in the same category, but they share some similar effects and dangers, including long-term harmful effects. Because gamma hydroxybutyric acid, GHB, and flunitrazepam can cause sedation, muscle relaxation, confusion and memory loss. The potential for sexual misconduct or sexual assault is associated with the use of these drugs. Signs and symptoms include hallucinations, paranoia, larger than usual pupils, chills and sweating, involuntary shaking, that is tremors, behavior changes, muscle cramps and teeth clenching, muscle relaxation, poor coordination or problems moving, reduced inhibitions, heightened or altered sense of sight, sound and taste, poor judgment, memory problems or loss of memory, reduced consciousness, increased or decreased heart rate and blood pressure. Another group is hallucinogens. Use of hallucinogens can produce different signs and symptoms depending on the drug. The most common hallucinogens are lysergic acid diethylamide, LSD, and phencyclidine, PCP. LSD use may cause hallucinations, greatly reduced perception of reality, impulsive behavior, rapid shifts in emotions, permanent mental changes in perception, rapid heart attack and high blood pressure, tremors, flashbacks. PCP use may cause a feeling of being separated from your body and surroundings, hallucinations, problems with coordination and movement, aggressive, possibly violent behavior, involuntary eye movement, lack of pain sensation, problems with thinking and memory, problems speaking, poor judgment, intolerance to loud noise, sometimes epilepsy, seizures, or coma. Inhalants. Signs and symptoms of inhalant use vary depending on the substance. Some commonly inhaled substances include glue, paint thinners, correction fluid, felt tip marker fluid, gasoline, cleaning fluids, and household aerosol products. Due to the toxic nature of these substances, users may develop brain damage or sudden death. Signs and symptoms of use can include possessing an inhalant substance without a reasonable explanation, brief, happy excitement, behaving as if drunk, reducing ability to keep impulses under control, aggressive behavior or eagerness to fight, dizziness, nausea and vomiting, involuntary eye movement, etc. Another group, opioid painkillers. Opioids are narcotic, pain-killing drugs produced from opium. are made synthetically. This class of drugs includes, among others, heroin, morphine, codeine, methadone, fentanyl, and oxycodone. Sometimes called the opioid epidemic. Addiction to opioid prescription pain medicines has reached an alarming rate across the world. Some people who have been using opioids over a long period of time may need physician-prescribed temporary or long-term drug substitution during treatment. Signs and symptoms of narcotic use and dependence can include a sense of feeling high, a reduced sense of pain, agitation, drowsiness or sedation, slurred speech, problems with attention and memory, pupils that are smaller than usual, lack of awareness, problems with coordination, depression, confusion, constipation, runny nose, needle marks. Planning and intervention. People struggling with addiction usually deny they have a problem and hesitate to seek treatment. An intervention presents a loud one with a structured opportunity to make changes before things get even worse and can motivate someone to seek or accept help. It's important to plan an intervention carefully. It may be done by family and friends in consultation with a healthcare provider or a mental health professional such as a licensed alcohol and drug counselor or directed by an intervention professional. It involves family and friends and sometimes co-workers, clergy, or others who care about the person struggling with addiction. During the intervention, these people gather together to have a direct, heart-to-heart conversation with the person about the consequences of addiction. Then they ask the person to accept treatment. The harms caused by drug trafficking and illicit drug economies are contributing to and compounding many of these threats, from instability and violence to environmental devastation. Illicit drug markets continue to expand in terms of harm as well as scope. From the growing cocaine supply and drug sales on social media platforms to the relentless spread of synthetic drugs, cheap and easy to manufacture anywhere in the world, and in the case of fentanyl, deadly in the smallest of doses. Drug use disorders are harming health, including mental health, safety and well-being. Stigma and discrimination make it less likely that people who use drugs will get the help they need. Implications and consequences. Substance use, misuse, and dependence contribute immensely to the global burden of disease. Their harm extends far beyond their corrosive effects on health, safety, and well-being, and additionally include those associated with healthcare expenditures, productivity losses, criminal justice involvement, and other negative effects on social welfare. The incidence and harms of substance use, misuse, and dependence involve multi-level explanatory factors. Interventions to reduce their individual and population level harms can often be hampered by biological, psychological, and social complexity, especially because substance use is often syndemic with other health and social problems such as HIV infection, hepatitis B and C, mental health disorders, and violence. Interventions to reduce the harms associated with opioid use. For people with existing opioid use disorders, opioid agonist treatment is known to reduce mortality. For people with opioid use disorders who either cannot or do not choose to achieve sustained remission, alternative approaches might be considered to reduce the harms associated with ongoing use. Special reference to drug misuse among adolescents. Adolescence is a crucial time for biological, psychological, and social development. It is also a time when substance addiction and its adverse effects are more likely to occur. Adolescents are particularly susceptible to the negative long-term effects of substance use, including mental health illness, subpar academic performance, substance use disorders, and higher chances of getting addicted to alcohol and marijuana. Research on psychological risk factors for teenage substance abuse is vast, wherein conduct disorders, including aggression, impulsivity, and attention deficit hyperactivity disorder, have been mentioned as risk factors for substance use. Parents' attitudes towards drugs, alcohol, academic and peer pressure, stress, and physical outlook are key determinants. Teenage drug usage has a significant negative impact on users, families, and society as a whole. There is much need for stringent policy and program guidelines to curb this societal menace. One of the adverse outcomes of adolescent substance use is the increased risk of addiction in those who start smoking, drinking, and taking drugs before they are of 18 years. Moreover, most individuals with substance use disorders begin using substances when they are young. Substance use disorders amongst adolescents have long-term adverse health effects but can be mitigated with efficient treatment. Childhood abuse is linked to suicidal thoughts and attempts. The particular mental behavior that mediates the link between childhood trauma and adult suicidal ideation and attempts is yet unknown. Prolonged opioid, marijuana, and binge drinking use are still common among adolescents and young adults. Drug-using students are more prone to commit crimes, including bullying and violent behavior. It has also been connected to various mental conditions depending on the substance use. Adolescent substance users suffer risks and consequences on the psychological, socio-cultural, or behavioral levels that may manifest physiologically. In India, alcohol and tobacco are legal drugs frequently abused and pose significant health risks, mainly when the general populace consumes them. States like Punjab and Uttar Pradesh have the highest rates of drug abuse, and The Indian government works hard to provide them with helpful services that educate and mentor them. This increases the burden of non-communicable illnesses too. In addition, several substances, drugs are narcotic and psychotropic and used despite the act named Narcotic Drugs and Psychotropic Substances Act 1985. Students are particularly prone to get indulged in substance abuse due to various reasons like academic and peer pressure, the appeal or popularity and identification, readily available pocket money, and relatively easy accessibility of several substances, especially in industrial, urban, elite areas, including nicotine, that's cigarettes. In addition, a relationship breakup, mental illness, environmental factors, self-medication, financial concerns, downtime, constraints of work and school, family obligations, societal pressure, abuse, trauma, boredom, curiosity, experimentation, rebellion, to be in control, enhanced performance, isolation, misinformation, ignorance, instant gratification, wide availability can be one of the reasons why one chooses this path. Globally, adolescent drug and alcohol addiction has significantly increased morbidity and mortality. The menace of drugs and alcohol has been woven deep into the fabric of society as its effects reach our youth. India's current generation is at high stake for risks associated with the abuse of drugs like cannabis, alcohol, and tobacco. Diagnosis. Diagnosing drug addiction, substance use disorder requires a thorough evaluation and often includes an assessment by a psychiatrist, a psychologist, or a licensed counselor. Blood, urine, or other lab tests are used to assess drug use, but they are not a diagnostic test for addiction. However, these tests may be used for monitoring, treatment, and recovery. For diagnosis of a substance use disorder, most mental health professionals use criteria in the Diagnostic and Statistical Manual of Mental Disorders, that is DSM-5, published by the American Psychiatric Association. Treatment. Although there is no cure for drug addiction, treatment options can help you overcome an addiction and stay drug-free. Your treatment depends on the drug use and any related medical or mental health disorders you may have. Long-term follow-up is important to prevent a relapse. Treatment programs for substance use disorder usually offer individual, group, or family therapy sessions, a focus on understanding the nature of addiction, becoming drug-free, and preventing relapse. Levels of care and settings that vary depending on your needs, such as outpatient, residential, and inpatient program. Withdrawal therapy. The goal of detoxification, also called detox or withdrawal therapy, is to enable you to stop taking the addicting drug as quickly and safely as possible. For some people, it may be safe to undergo withdrawal therapy on an outpatient basis. Others may need admission to a hospital or a residential treatment center. Withdrawal from different categories of drugs such as depressants, stimulants, or opioids produce different side effects and require different approaches. Detox may involve gradually reducing the dose of the drug or temporarily substituting other substances such as methadone, buprenorphine, or a combination of buprenorphine and naloxone. After discussion with the patient, healthcare provider may recommend medicine as part of the treatment for opioid addiction. Medicines do not cure opioid addiction, but they can help in your recovery. Behavior therapy. As part of the drugs treatment program, behavior therapy, which is a form of the psychotherapy, can be done by a psychologist or a psychiatrist, or you may receive counseling from a licensed counselor. Therapy and counseling may be done with an individual, a family, or a group. The therapist or a counselor can help you develop ways to cope with your drug cravings, suggest strategies to avoid drugs and prevent relapse, offer suggestions on how to deal with a relapse if it occurs, talk about issues regarding your job, legal problems, and relationship with family and friends. Include family members to help them develop better communication skills and be supportive. Address other mental health conditions. Self-help groups. Many, though not all, self-help support groups use the 12-step model first developed by Alcoholics Anonymous. Self-help support groups such as Narcotics Anonymous help people who are addicted to drugs. Self-help support groups can decrease the sense of shame and isolation that can lead to relapse. Coping and support. Overcoming an addiction and staying drug-free require a persistent effort. Learning new coping skills and knowing why to find help are essential. Taking these actions can help. Number 1, see a counselor. 2, seek treatment for other mental health disorders. 3, join a support group. Maladaptive substance use and substance use disorders are highly prevalent and are among the most significant public health problems. Substance use is commonly comorbid with psychiatric disorders, and treatment efforts need to concurrently address both. While treatments exist, the need for more effective treatments is clear, especially those focused on decreasing relapse rates. The negative affective state, hyperkatifia, that accompanies long-term abstinence is an important treatment target that should be emphasized in current practice as well as in new treatment developments. In addition to developing a better understanding of the neurobiology of addictions and abstinence, it is necessary to ensure that there is equitable access to currently available treatments and treatment programs. Additional resources must be allocated to this cause. Addiction has been conceptualized as a neurobiological disease in which repeated drug use yields lasting and widespread neuroadaptations that affect brain regions responsible for habit forming, emotional regulation, and cognitive processes. The biological model of addictions explain how these changes create a compulsion to continue using substances regardless of the consequences and how they make it hard for people to quit. Addiction is a lifelong condition that involves compulsive seeking and taking of a substance or performing of an activity despite negative or harmful consequences. Addictions can significantly impact your health, relationships, and overall quality of life. It is crucial to seek help as soon as you develop signs of addiction. Addiction is a disease. It is a chronic condition. The American Society of Addiction Medicine defines addiction as a chronic brain disorder. Addiction does not happen from having a lack of willpower or as a result of making bad decisions. Your brain chemistry changes with addiction. There are two main groups of addiction: substance addiction, substance use disorder; non-substance addictions, that's behavioral addictions. Humans are biologically motivated to seek rewards. Often these rewards come from healthy behaviors. When you spend time with a loved one or eat a delicious meal, your body releases a chemical called dopamine, which makes you feel pleasure. It becomes a cycle. You seek out these experiences because they reward you with good feelings. Substances send massive surges of dopamine through your brain. 2. As well as certain activities like having sex or spending money. But instead of motivating you to do the things you need to do to survive, that's eat, work, and spend time with loved ones, such massive dopamine levels can have damaging effects on your thoughts, feelings, and behavior. This can create an unhealthy drive to seek more pleasure from substance or activity and less from healthier activities. Over time, the substances or activities change your brain chemistry and you become desensitized to their effects. You then need more to produce the same effect. For some substances, such as opioids, the withdrawal symptoms are so severe that they create significant motivation to continue using them. Prevention. There are steps you can take to reduce your risk of developing an addiction, including avoiding or limiting substances that have addiction potential. Try to avoid or limit your use of non-medical substances and always follow your provider's orders to prescription medication use. If you feel like you are developing a dependence on prescription medication, contact your doctor immediately. Number 2, knowing your family history. If you have a family history of substance use disorders or behavioral addictions, you may be more vulnerable. Talk to your healthcare provider about ways to lower your risk. Healthily managing stress. The risk of substance use increases greatly during times of stress and change. It is important to turn to healthy coping mechanisms during these times, such as exercising, meditating, or learning a new hobby. Consider seeing a mental health professional if you are having issues managing your stress. With treatment, many people manage addiction and live full, healthy lives. But recovering from substance use disorders and behavioral addictions isn't easy. Supportive friends, Family members and healthcare providers play an essential role in effective treatment as well. Without treatment, addictions can cause serious health issues, even death. It can damage personal relationships, lead to financial difficulties, and cause legal problems. Untreated addictions also harms family members, and the effects can last for generations. It can be very challenging and stressful to learn that someone you love may have a behavioral addiction or substance use disorder. Some tips to help your loved ones and yourself are: number one, speak up sooner rather than later. Number two, practice empathy. Number three, be patient. Number four, take care of yourself. The family members of the people with addiction often experience stress, depression, grief, and isolation. It is important to take care of your mental health and seek help if you are experiencing these symptoms. World drug problems may be global, but they do not affect all the world equally. It is the vulnerable, the poor, and the excluded who pay the highest price in the global south and in underdeveloped and underserved communities in all our countries, cities, and villages. They suffer from the violence and insecurity fueled by drug trafficking, as well as from insufficient access to and availability of controlled medicines. Impoverished people with uncertain access to opportunities, resources, and the rule of law are more easily entrapped in illicit drug crop cultivation, production, and trafficking. Breaking these vicious cycles requires transformative action to achieve the sustainable development goals and integrated, comprehensive approaches to security to tackle drug threats as part of prevention and peace building. Putting people first requires policymakers and service providers to actively protect the human rights of all by demolishing barriers to evidence-based voluntary services across the continuum of care, dispelling gender, age, and other biases, and focusing on rehabilitation and reintegration instead of punishment. Early prevention is crucial, and the government must invest more in education to build resilience and give young people the information they need to make healthy, smart choices about their lives. Throughout, regulation that prioritizes public health can help. Thoughtful regulation that prioritizes public health can help to ensure access and availability where needed, while keeping commercial pressures in check and reducing the risks of diversion and non-medical use. Stigma and discrimination can be deadly, depriving people of the help they need and deserve, and keeping problems in the dark until it is too late. Evidence can help shine a light on the challenges we can only face together, and it is with this in mind. Global action is required to treat this problem once for all by making interventions that are evidence-based to reduce morbidity, mortality, financial and social burden. Capacity building is optimized when clinical expertise is partnered with regional community stakeholders and government in the context of a unified strategy to expand substance use disorder treatment services. Workforce expansion for substance use disorder treatment delivery harnesses community stakeholders to participate actively as family and peer supports and as trained lay health workers. Longitudinal supervision of the workforce and appropriate incentives for service are required components of a sustainable community-based model for substance use disorder treatment. Implementation would benefit from research investigating the most effective and culturally adaptive models that can be delivered in diverse settings.